I'm Donna Larson. I'm a dietitian in the Nutrition Center at Iowa Lutheran Hospital, and I'll be speaking about Heart Healthy Eating, a Foundation for Good Health. This is based on the American Heart Association 2006 guidelines to reduce your risk of heart disease. There's 9 different guidelines that we go through that we'll be talking about today. The first is to aim for a healthy body weight, and each of these we'll be going into in more detail. Eating a diet rich in fruits and vegetables, choosing whole grain, high fiber foods, consuming fish, especially oily fish, at least twice a week, limiting saturated fat, trans fat, and cholesterol, minimizing added sugars, consuming little or no salt. If you drink alcohol, doing so in moderation, and when eating out, follow the previous 8 guidelines. The thing I like to point out about these guidelines is that this is a healthy way of eating, not a diet as such. It's a way we would recommend for all ages, from about the age of 2 all the way through 102. And it's supported not just by the Heart Association, but the Diabetes Association, National Institutes of Health, and really all major health groups. And it's also what the 2010 Dietary Guidelines for Americans, the Choose My Plate, are based on. So the first thing we mentioned, balancing calories. The key is to burn up at least as many calories as you eat and drink each day. So to know about how many calories you need to maintain your weight or to lose weight, you can go to the Choose My Plate website and plug in your age, your sex, and your activity level, and it'll tell you approximately how many calories you need per day. To balance calories, you need to remember that a pound of body fat is equal to about 3,500 calories. If you divide that by 7 days in a week, to lose 1 pound a week, that would mean you need to decrease your calorie intake by about 500 calories per day, or burn up 500 extra calories per day. Ideally, it would be a combination of both, exercising more and eating less. And you can see if you want to only lose a half pound per week, it would be 250 calories per day. 2 pounds per week would be 1,000 calories per day, which is pretty ambitious, especially for a woman for weight loss. Some tips to control weight: you need to eat adequate calories. We don't recommend anything less than about 1,200 calories a day for a woman or 1,500 calories a day for a man. This is because if you cut your calories too low, your body thinks you're starving it, and it lowers your metabolic rate, and you end up spinning your wheels. It's even harder to lose weight. It's important to choose high nutrient, lower calorie foods. So technically you could eat 1,200 calories of M&Ms and still lose weight, but you wouldn't be getting the vitamins and minerals, the satiety from your meals that you need to. And we want you to balance your nutrients. So we want you to have healthy carbohydrates, which are ones higher in fiber, healthy proteins, so in this case especially lean protein, and healthy oils, and we'll be talking a little more about which ones those are. The next guideline, consuming a diet rich in fruits and vegetables. This is about 5 to 7 servings of fruits and vegetables a day. If you choose the brightly colored ones like blueberries, strawberries, citrus fruits, kiwi, broccoli, carrots, tomatoes, those sorts of things, you're going to have a diet rich in antioxidants, which can decrease your risk of disease by helping you build a strong immune system and resist things like flu and colds, or at least shorten their duration, but also more major chronic diseases like heart disease and diabetes. The other advantage of the fruits and vegetables is that if you're choosing fresh or frozen or canned without salt, they're also low in sodium. The brightly colored ones are usually a good source of potassium, which can help control your blood pressure, and a good source of fiber, as well as being low in calories. The next thing they recommend is eating more whole grains. And there are some examples here of some whole grains, things like whole wheat, whole oats, whether that be oatmeal or steel cut oats, whole grain corn. Popcorn is actually a whole grain. whole grain rye, barley, buckwheat, quinoa, which is actually an ancient grain that's making a resurgence in our area, and things like amaranth and sorghum and those sorts of grains as well. And the next slide shows some of those whole grain pastas and whole grain bread and cereal and so on. Part of the reason for eating whole grains is to get more fiber in your diet. There are two types of fiber, soluble and insoluble. Soluble fiber is the one that's especially important because it can lower your cholesterol as much as 10%. It absorbs cholesterol in your GI tract, so then it's not reabsorbed. And the best sources are oat products, whether it be oatmeal, Cheerios, steel-cut oats, and the more whole grain it is, the higher the soluble fiber intake would be. Also fruits rich in pectin, like apples and oranges and dried fruits. But by far the highest soluble fiber content is going to be in legumes, like kidney beans, black beans, chickpeas, or garbanzo beans. And those are the ones that have the largest amount of soluble fiber per serving. About 3 grams per half cup serving compared to about 1 gram in a half cup of oatmeal. For every 1 to 2 grams of soluble fiber that you eat, you can lower your LDL by about 1%. The goal is 10 to 25 grams of soluble fiber a day, but you'll find if you look at soluble fiber content of foods, 25 grams is very ambitious. It's great for just fiber in general, but if you can get 10 grams of soluble fiber a day, that's doing good. Because as I said, a half cup of something like beans is only 3 grams. With the fiber, the important thing to remember is to increase your fiber intake gradually. If you go from a very low fiber diet to a high fiber diet overnight, you're going to have some abdominal discomfort, gas, possibly even diarrhea. So you want to increase your fiber by only about 5 grams per week. And the other important thing with increasing fiber, or anytime you're taking a fiber supplement or whatever, is to drink plenty of water along with that. Some ways you can add fiber to your diet are by eating a high fiber breakfast cereal like oatmeal, steel-cut oats, and so on. Adding dried beans like kidney beans or black beans to soups, to salads, to wraps, tacos, that sort of thing. Sprinkling oat bran on other cereals. Eating whole fruits for snacks or possibly dried fruits. Choosing vegetables that are high in soluble fiber like green beans, Brussels sprouts, peas, sweet potatoes. Eating a bean dip or something like hummus, which is made from garbanzo beans, as a snack. And looking for whole grain products that have oats or barley. There's also the option of taking a psyllium fiber supplement. Psyllium is a product that is very high in soluble fiber. It's found in products like Metamucil or Citracel. And some people do go to start taking a fiber supplement like that to lower their cholesterol, especially if they don't tolerate some of the cholesterol-lowering medications, or if their medication doesn't lower their cholesterol enough. The next guideline is to consume fish, especially oily fish or what I would call cold water fish, at least twice a week. The oily fish or cold water fish have the advantage of being high in omega-3 fatty acids, which is another thing that we'll be discussing. And that includes salmon, tuna, lake trout, halibut, also things like sardines and herring, but those are high in sodium. So if you're trying to limit your sodium intake, they would not be as good a choice. Other lean fish would also be lower in saturated fat than red meat, and that would include tilapia, orange roughy, cod, just about any other white fish. Water-packed tuna would be a good choice, and that would also contain omega-3 fatty acids. But do limit albacore tuna to about 6 ounces per week because of the mercury content. There are other varieties of tuna available, tongal, not redfin, but bluefin or yellowfin tuna, and try to make a point of not frying the fish. The slide shown here shows you the omega-3 content of a number of 3-ounce portion of fish. And you can see that salmon is pretty close to the top of the list and higher than a lot of things like haddock or some of the canned tuna. And this is also a picture of salmon. This is more than a 1 serving size. This is probably at least a 6-ounce portion. Now we're going to be talking about fats and cholesterol and limiting your intake of those. So some terms we'll want to go through are cholesterol, triglycerides, saturated fat, trans fat and hydrogenated fat, and unsaturated fats. So let's start with cholesterol. Cholesterol is a fat-like waxy substance. It's only found in animal products. And originally when they started labeling cholesterol, they would make statements on things like margarine or plant products saying no cholesterol. Well, they come from a plant, so of course they had no cholesterol. Our liver makes all of the cholesterol we need. We really don't need to get any from our diet, so we don't need to worry about eating enough cholesterol. It is essential to every cell in your body. It's important for cell membranes, for hormones, for vitamin D. So we do need some cholesterol, but as I said, our body produces more than enough, and for many of us, more than what we need. There are 2 types of cholesterol. There's LDL cholesterol, which stands for low density lipoprotein. It's usually thought of as bad cholesterol, or an easy way to remember it is lousy cholesterol. The other type is HDL cholesterol, which stands for high density lipoprotein, and sometimes is called healthy cholesterol. LDL, as I said, is called bad cholesterol. It's a cholesterol carrier, and it carries cholesterol through your bloodstream, where then it's available to build up as plaque on your artery walls. As your LDL level rises, so does your risk of heart attack and stroke. So that's why we want to lower LDL. HDL, however, the good cholesterol, is also a cholesterol carrier, but it carries cholesterol to your liver, where it's broken down and removed from your body. So a high level of HDL helps protect you from heart attack or stroke. And when we talk about your numbers for a good lipid profile, you'll see that a high HDL is what we call a negative risk factor. It takes away one of your other risk factors. Triglycerides are another type of blood fat. They're created from eating too many calories, drinking too much alcohol. They are created from simple sugars, which would be candy, sodas, desserts, those sorts of things. And it's the storage form of fat in our body. High triglycerides increase risk of heart disease. That's one of the symptoms of metabolic syndrome, which is part of Journey to Wellness. So high triglycerides are also sometimes associated with high levels of glucose in your bloodstream. Although I've had patients with very high triglycerides with normal blood sugar and normal triglycerides with high blood sugar. So it doesn't necessarily follow hand in hand. Now, the recommended level for blood lipids are listed here. This is an area where they have gradually lowered what they want your normal values to be, just like with blood pressure and blood sugar. So total cholesterol should be below 200. Triglycerides should be less than 150. HDL, your good cholesterol, we want at least over 40, but usually we say over 45 in a man and over 50 in a woman. Women do tend, or premenopausal women anyway, tend to have higher HDLs than men. And an HDL over 60, as I mentioned earlier, is gives you some protection against heart disease and is a negative risk factor. The LDL number varies depending on your health history. If you have diabetes, heart disease, or chronic kidney disease, your doctor would probably tell you he wants your LDL below 70. For the general population, technically I think the guideline is still less than 130 unless you have several risk factors, but most family doctors are now saying they want your LDL below 100. Let's move on to types of dietary fat. There are 4 different types of fat in our diets. Saturated fats are ones that are usually solid at room temperature. There's trans fats, which are hydrogenated fats, and they are also solid at room temperature. Polyunsaturated and monounsaturated are both liquid at room temperature. Now, saturated fats are considered harmful. They raise your bad cholesterol, they lower your good, so they move both of those in the wrong direction. The sources are found mostly in animal fats like poultry skin or the fat right under the skin, butter, high-fat dairy products like whole milk, half and half, and those sorts of things. Fatty meats like sausage and hot dogs and those sorts of things, lard and so on. They're also found in tropical oils, coconut oil and palm oil. So those 2 oils do not have cholesterol because they're from plant sources, but they do contain saturated fat. And also there is some found in cocoa butter in solid fat. Trans fats right now are probably considered the most harmful. They also raise your bad cholesterol and they lower your good cholesterol. There's 2 types. There's natural and man-made. Now, natural trans fats are found in ruminant animals like cattle, animals that have 2 stomachs, cows, dairy, and lambs. But that's really a very small part of the trans fats in our diets. Most of it we find in hydrogenated oils and shortenings. Stick margarine is probably one of the most common. In the past, there was quite a bit of trans fat in crackers and cookies and things like that that you would buy in the snack food section. But when they started labeling for trans fat in 2006, they changed their ingredients and it's much less now. The goal is to minimize trans fats, less than 1 to 2 grams a day, but generally I say your goal really should be 0 trans fat, because on a food label, a product can have almost half a gram of fat, or excuse me, half a gram of trans fat, and still say it has none. So you do need to check ingredients for hydrogenation and so on. As I said, most foods are labeled, so you'll know the trans fat content. Where you're going to run into a problem are things like bakeries, fried foods, and things like that that won't have a label telling you necessarily what type of fat they used and how much trans fat they have. So you could easily find it in cakes, cookies, muffins, donuts, French fries, those sorts of things that you might get at a restaurant or in a bakery. Polyunsaturated fat is a better type of fat. It lowers your LDL, your bad cholesterol, but unfortunately it works so well it also lowers your good cholesterol. The exception would be the omega-3 fats, like some of the ones in flaxseed and canola oil, or some of those sorts of things. The sources for oils would be corn, cottonseed, safflower, sunflower seed oil, and some nuts and seeds like flaxseed and walnuts. Now, there are a number of benefits of omega-3 fatty acids as long as we're talking about that. The main one is it is one of the few ingredients or items contained in a food that has been approved for a health claim that it decreases risk of heart disease. We do know it lowers triglycerides, and that's why some people are put on an omega-3 supplement from fish oil or that sort of thing. It may raise HDL levels, and it is hard to raise HDL. It seems to work to raise HDL in some people, but it's not consistent enough that they can really make a claim for that. It reduces inflammation of artery walls, and that's another reason. It's been thought that it may decrease pain from arthritis. It may work in cases of things like depression, macular degeneration, any number of inflammatory processes. So those are being studied and sound promising, but the only one proven is for decreasing risk of heart disease. Foods high in omega-3 fatty acid include that cold water or oily fish that I was mentioning. The fish includes salmon, tuna, halibut, lake trout, those sorts of things. There's some in canola and flaxseed oil, although that's a little bit different type of omega-3 that we'll be talking about, and some in nuts and seeds as well. Now, the best way to get your omega-3 fatty acids is from those oily fish that I mentioned. But sometimes people are allergic to fish, just don't like fish, or don't want to eat fish that often. So those people can benefit from taking a fish oil supplement. The two active ingredients in the fish oil is EPA and DHA. So when you buy a fish oil supplement, you need to check the back of the label for how much of those they contain. The Heart Association would recommend, just for decreasing risk of heart disease, about 1,000 milligrams of omega-3 a day of those two active ingredients. An important thing to remember, though, is that the amount of listed on the front, it may say 1,000 or 2,000 milligrams of fish oil, but you need to remember that fish oil is only about 30% omega-3s. So it's still important to look at the back of the label and see how much EPA and DHA it contains. So you take the number of capsules per day to reach 1,000 milligrams. So it might say 300 milligrams EPA and 200 milligrams of DHA. And if one capsule contained that amount, to get 1,000 milligrams, you would need 2 capsules. It seems like for almost all the brands, the magic number seems to be about 3. And for people with elevated triglycerides, they recommend 4,000 milligrams of omega-3 fatty acids per day, which in the form of fish oils is going to be a lot of capsules. That would be probably about 12 a day. There are some like Lovesa, which is a prescription medication that's fish oil that you can take, but a lot of the insurance companies still don't cover for that. You may want to look for, most of the fish oil now is coated, so you don't need to worry about burping a fishy taste. If that's a problem, though, 2 things to remember: take your fish oil with food, and also manufacturers recommend if you freeze your fish oil capsules, you don't seem to have a problem with burping. I think that's partly because the fish oil gets further into your GI tract before you digest it, and you're less likely to get that fishy taste. So when you look for fish oil, as I said, look at how much EPA and DHA they have. Sometimes they will be listed as double strength. That sometimes just means that you need to take 2 pills, not that it's actually any stronger. All the major brands are mercury-free, so you don't usually need to worry about that. And if you are a vegan, you can get DHA made from algae, but there is no vegetarian source of EPA. DHA is the omega-3 that seems to affect more brain health, and EPA is more for heart health. And that's why infant formulas are now fortified with DHA for infant brain health. The last type of fat, monounsaturated fat, is probably considered to be the best because it lowers your bad cholesterol and spares your good cholesterol. It doesn't lower the HDL, but it doesn't, it doesn't raise the HDL, but it also doesn't lower it. So that's a good thing. You still need to use it moderately. It is still fat, and fats have twice the calories that carbohydrates and proteins do. So it needs to be moderate use. Sources from plants include canola oil, olive oil, peanut oil, also avocados, olives, and peanut butter without trans fat. You can get some in almonds, pistachios, pecans, hazelnuts, and a little bit in cashews, but somewhat less. And this slide shows you some of the foods high in omega-3 in monounsaturated fat, like avocados and some of the nuts that I mentioned. Cholesterol is the next thing we'll talk about. As I mentioned earlier, cholesterol is found only in animal foods. It's highest in things like egg yolks, liver, which is where cholesterol is stored in any animal's body, shellfish like shrimp, lobster, crab, that sort of thing, and whole milk. Dietary cholesterol can raise your blood cholesterol, but actually saturated fat and trans fat probably raise your cholesterol more than actually eating fat. So the key points for a heart-healthy fat intake include choosing foods low in saturated fat, trans fat, and cholesterol, replacing some of the saturated fat, the solid fats in your diet, with unsaturated or liquid fats, and also decreasing your total fat intake. So even with the healthy fats, they need to be in moderation. Another way to do this is to choose low-fat protein sources in smaller portions. A portion of fish or meat or poultry is considered 3 to 4 ounces, which is, with fish would be about the size of a checkbook. With beef or pork or chicken, it's about the size of a single deck of playing cards, or about the size of the inside of my palm and thickness of my thumb. The total intake per day, even of lean meats, a good guideline is only about 5 to 6 ounces, which is a lot less than what most Iowans eat. But learn to stretch your meat by mixing it with vegetables, beans, rice, or pasta. Casseroles, sandwiches, and those sorts of things can make a little bit of meat go a long way and make you think like you're getting more. When you prepare the meat, you want to take off any visible fat. Take off the poultry skin, that's where most of the fat and cholesterol is. Use low-fat preparation methods, where that be grilling on a tabletop grill like a George Foreman type grill, grilling with charcoal or gas, broiling, oven roasting, baking on a rack, cooking with a crock pot but having the meat setting on the rack so that the extra fat would cook off. And cook the meat until it's fairly well done, and then if there's still visible fat, remove that as well. Other ways are to cut back on some of those really high cholesterol foods. The goal is to eat less than 200 milligrams of cholesterol per day. And I wouldn't expect you to keep track of your cholesterol intake. If you're limiting your meats, using mostly plant oils and those sorts of things, you're going to be under your cholesterol intake most days, except when you eat an egg yolk. But the goal is less than 200 milligrams per day. Remember that some foods are really high. A 3-ounce portion of liver is about 375 milligrams of cholesterol. So that's about double what we should be eating. And so if you now have an excuse not to eat liver if your cholesterol's high. Shrimp and shellfish have anywhere from 50 to 100 milligrams per half cup, or about 3-ounce serving. They are okay to eat because they are low in saturated fat, but normally we would say to limit those to about 3 ounces per week. The only shellfish I can think of that is not very high in cholesterol would be scallops. Eggs, all of the cholesterol is in the yolk. One yolk is about 185 milligrams of cholesterol. And you may have heard that eggs have less cholesterol than we used to think. But 185 is the new lower level. They used to think they were over 200. The Heart Association has loosened up a little bit on their egg yolk recommendation. They now say 3 to 4 egg yolks a week. There's no restriction on egg whites, so you can have as many whites as you want. And egg substitutes are made out of egg whites, so they are fine to use as well, and those don't need to be limited. With dairy products, the regular full fat and 2% milk fat dairy products have cholesterol and significant levels of saturated fat. So choose fat-free or 1% milk. The difference between 8 ounces of whole milk and 8 ounces of skim milk is about 60 to 70 calories. And the difference is entirely from the fat content. So 8 ounces of whole milk has the equivalent of 2 teaspoons of butter in it. 2% has the equivalent of 1 teaspoon of butter, 1% is half a teaspoon, and skim milk is none. So you're not losing any of the important ingredients by switching to a lower fat milk. You still have the same amount of protein, calcium, and vitamin D. It's only the calories and cholesterol and saturated fat that you're cutting down on. Also look at low-fat or non-fat yogurts. With cream, you can get fat-free half and half now. Low-fat or non-fat cottage cheese, light or fat-free sour cream, same way with cream cheese, and choosing a low-fat cheese that's about 3 grams of fat per ounce, 3 to 4 grams of fat per ounce, which is a little bit hard to find. Even with string cheese, everyone thinks that mozzarella cheese is low-fat, and mozzarella cheese is generally less fat than cheddar. Cheddar cheese, for instance, or provolone would have about 10 grams of fat per ounce. Regular mozzarella is about 6 grams, but truly a low-fat one would be 3 to 4. So with things like string cheese, for instance, go with the low-fat string cheese. That's going to be in the 2.5 gram of fat per ounce range, and it does make a difference in calories. With visible fats and oils, how much should you eat? Well, moderation is the key. I would say for your average person trying to maintain their weight or lose weight, we would only say 3 to 5 servings of fat a day. And a serving of fat is about 5 grams of fat. It would be a teaspoon, a measuring teaspoon of oil or soft margarine, a tablespoon of a salad dressing like French, Italian, or Western, or 2 tablespoons if it was a light salad dressing. An ounce of nuts is not a serving. Actually, only a tablespoon of nuts is a serving. But I kind of take nuts out of this fat category, not because they don't contain fat, but the Heart Association has an additional recommendation where they suggest that eating an ounce of nuts up to 5 times a week can be beneficial. It's a good way to take the edge off your appetite. It's a source of fiber, some protein, a little bit of carbohydrate, and it's healthy monounsaturated fat. And an ounce of nuts, which is about 24 almonds or 14 walnut halves, is about 165 calories, which is kind of a nice amount if you're adding a snack in the afternoon. Other ways to add up or to cut down on fat are to use light or non-fat mayonnaise or Miracle Whip type products, light salad dressings like a light Italian or French or whatever. And it's kind of up to you. Sometimes the fat-free tastes as good as the light, which may taste as good as the regular, but everyone's taste preferences are different. So I might like the light version, you might like the fat-free. And in cooking, for instance, I might use fat-free Italian dressing in making a pasta salad, but in putting dressing on my salad, I might go with a light. So there's a lot of give and take here, and you can give up a little here and add on a little there. So in summing up fats and oils, try to go more with liquid oils, especially monounsaturated like olive, canola, or peanut oil. With margarines, you can also go with spray margarine, like I Can't Believe It's Not Butter in a spray. That actually, if we took the lid off the bottle and poured it out, would be buttery flavored oil. But because it's dispensed in a pump, or the nonstick sprays like Pam or some of those things, you use very little in a serving. So those can come in handy. And then the soft margarines are also good. Avoid stick margarine. Most of those contain trans fat. There are a few that have no trans fat that are handy for baking, but they do have more saturated fat than a soft margarine. You can use a reduced fat mayonnaise, and really with salad dressings, probably the best would be using a vinegar and oil of your own making. Now, plant sterols and plant stanols are things that are found in plants that have a chemical makeup very similar to cholesterol. For some reason, though, our body prefers the plant sterol or stanol over cholesterol. So if you eat plant sterols and stanols, your body absorbs them rather than the cholesterol, and then some of that cholesterol is excreted in your body. It's thought that based on research, if you eat 2 grams of plant sterols a day, you can lower your LDL by as much as 10%. Now, although they're found naturally in foods like fruits and vegetables and nuts and seeds, it's not possible to get 2 grams just from the food you eat. It literally takes about 60 pounds of carrots to get 2 grams of plant sterols a day. So the FDA has approved a health claim on food labels about plant sterols and lowering their risk of heart disease, and some foods are now fortified with those. You might see them in some margarines like Benecol or Promise Active. Unfortunately, with those products, though, the amount you have to eat to get the full 2 grams is about 6 servings a day, which is, and I just finished telling you that 3 to 5 servings of fat is the amount that you should restrict your fat intake to. So it's really more than we need. Some tortilla chips are supplemented with those. Some crackers, like Kashi has a cracker that's very similar to a Triscuit type cracker that has some plant sterols added. Minute Maid has an orange juice that has plant sterols added, but it takes 2 cups of orange juice to get the full 2 grams that you need, and those calories start to add up. The other thing to look at with these foods is sometimes it's hard to determine how much plant sterols are in them, but often it's not enough to do much good, and you're paying a premium on price. So you have to look at that and kind of weigh for yourself if the benefit outweighs the cost. You can also take them in supplement form. There's one called Cardiosterols that's available from Cardiotabs. Also, Cholestoff is another one that's available in local drugstores. The thing to remember again about those, unfortunately, the cost of those is actually more expensive than taking a generic statin. So it does have some disadvantages. Another guideline from the Heart Association is to minimize added sugars. There's a number of reasons for this, partly to lower calories if you're trying to manage weight, to promote nutrient adequacy, because sugar is basically empty calories. It provides us with calories, but really no nutritional value at all. If your triglycerides are high, eating or drinking a lot of sugar can raise your triglycerides. If you're pre-diabetic or diabetic, it also raises your blood sugar. So to eat less sugar, one of the first things you can do is to cut down on or avoid sweetened beverages. We get a lot of sugar from soft drinks, sweetened beverages like cappuccinos, frappuccinos, sweet tea, Kool-Aid, and actually fruit juices. Although fruit juices have vitamins and minerals, the calories and carbohydrate and sugar content is almost the same as a soft drink. Also limiting some of those sweet condiments like table sugar, honey, jams, jellies, those sorts of things. Looking at fruits canned in their own juice or fresh fruits would be a better choice than fruits in heavy syrup, and keeping desserts to a minimum. One of the things that the dietary guidelines recommend is enjoying your foods but eating less of them. So it doesn't mean you can't have sweets or desserts anymore, but we need to eat the foods that are good for us first, and to try to keep desserts and the high sugar items in smaller amounts. To check labels, you can look at to find the sugar content, and you want to choose foods that don't have sugar in the first 3 to 4 ingredients. That would be the healthiest. And to help you visualize how much sugar is in a product, 4 to 5 grams of sugar is about equivalent to a teaspoon of sugar. So if we were looking at a 12-ounce soft drink, that has the equivalent of about 9 teaspoons of sugar in it. A liter bottle has the equivalent of half a cup of sugar. Most of us wouldn't think about sitting down with a cereal bowl with a half cup of sugar in it, but that's what you're getting if you're drinking a 1 liter bottle of a sweetened soft drink. The next thing we want to talk about is cutting down on our salt intake, consuming little or no salt. Eating too much sodium can result in fluid retention, it aggravates congestive heart failure. It won't necessarily cause congestive heart failure, but if you have a tendency for that or have been diagnosed with that, it really does aggravate it. And which causes also that fluid retention is an increased workload on your heart and on your lungs as well. The key is to avoid salting food. Only about 20% of our sodium intake comes from salt we've added. That other 80% is from convenience foods. So also it's important to limit salty or processed foods and season more with herbs and spices. Now that was another focus of the 2010 dietary guidelines for Americans, the Choose My Plate. They were very concerned about the amount of sodium Americans get from all the convenience foods we eat, and restaurant meals are notoriously high in sodium as well as fat. Sodium is an electrolyte important in fluid balance in the body. It does have an affinity for water, so as I said, it does cause fluid retention. Excessive sodium can result also in an increased workload on your heart. And salt is sodium chloride. It's about 40% sodium. The taste for sodium is an acquired one. We aren't born liking salt. It's something we learn very quickly. Now, sodium requirements and average intake are shown here. We really only need about 200 milligrams of sodium a day, which really we can get by drinking a glass of milk and eating a slice of bread. We really don't need to add salt to our foods. The newest guidelines say anyone 51 or older, or African American because they have a greater risk of stroke, or anyone with heart disease, diabetes, or chronic kidney disease should keep their sodium intake to 1,500 milligrams per day. And that's pretty hard to do. A half of a teaspoon of salt is 1,200. And even our hospital meals are usually not much less than 2,000 milligrams. The amount recommended for the general population is 2,300 milligrams of sodium, and that's about just a little less than a teaspoon of salt. And the average American intake is anywhere from 6,000 to 10,000 milligrams of sodium. One bouillon cube is about 800 milligrams. A serving of canned soup could easily be 1,200 to 1,600. And a meal at a restaurant might be 2,500 to 3,500 milligrams of sodium. So if you eat out frequently, you really have a challenge to limit your sodium intake. Some of the highest sodium foods, as I said, we get some from table salt. It does occur naturally in foods. Milk contains sodium naturally, although most people are not going to drink enough milk that's going to be a problem for them as far as their sodium intake is concerned. And meats like, any animal product like red meat, poultry, fish, anything that has had blood circulating through it at one time, even though when you're eating the meat that's been drained out, blood is a saline solution, a salt solution. So even plain fresh meats will have a little bit of sodium. But realize that a lot of the meats that we might think are fresh, like pork chops, for instance, are often injected with a salt solution to tenderize them, and because Americans like salt. Another example would be some of the boneless, skinless chicken breasts that you get in the frozen food section in the 2 to 4 pound packages. At the store I shop at, one variety has 200 milligrams per serving, another has 500. So although you may be buying one with salt added, at least you can make comparisons and make the lower sodium choice. Other ways we get a lot of sodium in our diets are from processed foods, whether it be canned products like vegetables, soups, canned meal or processed, not canned meals, but frozen meals, TV dinners, condiments and sauces like barbecue sauce, ketchup, mustard, soy sauce, Worcestershire sauce, those sorts of things. Foods prepared in a brine like sauerkraut or pickles, or smoked products like ham or bacon, convenience meals, as I mentioned, and a lot of the snack foods. So really take a look at the sodium content. Another thing with salt, very often I'm asked if sea salt is better than table salt. Technically, sea salt has just as much sodium ounce per ounce as regular table salt does. The only way it would have less is if, for instance, sea salt is often coarsely ground. So a teaspoon of sea salt, if it's coarsely ground, will not hold as much by weight as granulated salt. But a lot of sea salt now is available granulated. The other way you may use less is because sea salt is thought to have more flavor. So again, if because it's more flavorful you use less of it, then the sea salt would be a better choice. But ounce per ounce, sea salt has just as much sodium as regular salt. The next guideline is to consume alcohol in moderation. Although some alcohol intake has been associated with decreased risk of heart disease, primarily intake of red wine, it may have heart-healthy benefits, but there are potential risks. If used in large amounts, of course, it contributes to weight gain, high blood pressure, high triglycerides, and of course, in excessive use, alcoholism. The Heart Association recommends if you do not drink, don't start. In other words, don't take red wine medicinally if it's not something you enjoy in the first place. And when they talk about drinking in moderation, what that is no more than 0 to 1 drink a day for women and 0 to 2 drinks a day for a man. And that doesn't mean that you can save up for the weekend and have 7 to 14 drinks. It doesn't quite work that way. What counts as a drink is 12 ounces of beer, 4 to 5 ounces of wine. Realize that 4 to 5 ounces is probably a smaller portion than what we would be drinking. The average wine glass now is a 13-ounce glass, so you could be having 3 times that in one drink. 1.5 ounces of 80 proof distilled spirits and 1 ounce of 100 proof distilled spirits. And remember, alcohol in moderation, and it's best consumed with food. When you eat out, you want to try to abide by all the earlier recommendations we talked about. You can eat out and eat healthy too, but it is a matter of balance. There are a number of challenges. Portion size, I'm not sure why restaurants serve such large portions. You would think that it would make more sense for them to serve smaller portions and charge you just as much, or hopefully charge you less, but that doesn't normally happen. The availability of healthy food choices, it's slowly getting better, and some of the major health groups are really working on having the restaurants decrease their sodium intake, at least, if not their fat. But it will be done very slowly over a period of time because they really don't want people to notice, consumers to notice that they're decreasing the sodium content. And you also don't have a lot of control over how food is prepared. So you need to do things like share a meal, take home the extra. When you go to the restaurant, ask a lot of questions, get your salad topping on the side, your sandwich toppings on the side, your potato toppings. You can go with things that are baked or broiled or grilled rather than breaded and deep fat fried. So you do have a little bit of control, but you actually probably have more control over the fat than the sodium. Overall, you need to think moderation and balance. Permanent changes in dietary habits are a gradual process. You don't have to change everything at once. But if you have a goal, you can work towards that and choose 1 or 2 things at a time and start making progress in that way. A series of small dietary changes established over time will really lead to long-term results, and they're ones you'll be able to maintain. If you go on a diet that is too severe and too strict, I worry that too often we'll just burn out and only be able to follow it for a couple months at most. So you really need to go about it slowly and gradually and think about it as healthy eating and, as I said earlier, not a diet per se. There are some websites listed here with heart healthy information. They include the American Heart Association website, Eatright.org is the Academy of Nutrition and Dietetics website, and there is a lot of free information on the Choose My Plate website as well. On the Choose My Plate website, there are menus. As I mentioned earlier, there's a formula where you can figure out your calorie needs. There are little activities in there for kids to do as far as healthy eating. A lot of good information. And then websites like the Mayo Clinic website also have a lot of reputable information that you can get there. If you have any questions, feel free to contact us. The phone number and my email are listed on the slide. And good luck with your changes in your eating habits.